Hi everybody, this is Ezekiel. Today I want to talk about the use of antibiotics and subsequent weight gain. And specifically about the use of antibiotics in childhood, specifically during infancy and the long-term consequences of the potential long-term consequences of using antibiotics during infancy, and particularly under the age of 3 years of age, and possible weight gain that can stay around into childhood, into adolescence, um, and even into adulthood. So like first thing I want to say is that like this video is not, like bashing antibiotics, or the use of antibiotics. It's more about a video about warning people about the dangers of overusing antibiotics and using antibiotics when they're not necessary. So I just want to start by like listing a few of the positives of antibiotics. So antibiotics, like they save lives. Um, like so many bacterial infections like tuberculosis, pneumonia, meningitis, all of them can be cured with antibiotics. And prior to antibiotics, like a lot of people did die of these, and like they had a very high death rate. The other thing is that without antibiotics, like modern medicine would not be possible at all. So things like surgery, just would not be possible. In a lot, well, you could perform surgery, but the risk of like the patient obtaining a bacterial infection would be really high, and you might be better off. You might be end up doing less harm not performing surgery rather than performing surgery without antibiotics. Then the patient gets a bacterial infection and ends up worse off. So things like cesarean sections, which have saved so many lives of mothers and mothers to be, that would not be possible without antibiotics. And then things like chemotherapy, that would also not be possible without the use of antibiotics. So just concerning the use of antibiotics during childhood. So I was looking at a study done by the CDC, the Center of Disease Control. It's like everyone knows what the CDC is, but like it's in the US, and they did a study that showed that between 50 to 70% of all antibiotics prescribed to children in the US um, were like unnecessary. So as little as 50%, but possibly as high as 70%, um, were just prescribed completely unnecessary. And when the average 2-year-old American, sorry, when the average 2-year-old Americans gets prescribed about 3 courses of antibiotics, and by the time that American is 10 years old, they get about 10 courses of antibiotics. So, the average American is taking a lot of antibiotics. Um, and a lot of the time, they are using antibiotics, like I've just said, like for completely unnecessary reasons, and for like upper respiratory conditions, like um, upper respiratory infections. Like most of the time, I think 80% of the time, they're caused by viruses. So, like antibiotics, as you know, are used to treat bacterial infections, not viral infections. So using an antibiotic to treat a viral infection is not going to do anything. Another condition that antibiotics are used to treat is conjunctivitis. But conjunctivitis, like I think again around 80% of the time is caused by a virus. It can sometimes be caused by bacteria, um, but even if it is caused by bacteria, it very often clears up on its own. But it does take a good bit longer. So yeah, antibiotics are used oftentimes completely unnecessary for conjunctivitis. But again, the doctor does have a hard time telling whether the conjunctivitis is caused by a virus or by a bacteria. Another type of infection that children get a lot of the time is our ear infections. Again, the doctor is going to have a very hard time telling whether it's caused by a virus or by a bacteria. But again, just to be on the safe side, he will probably prescribe an antibiotic. Now, ear infections can be quite dangerous if it is caused by a bacterial infection and antibiotics aren't used. They can be very damaging. The bacteria can get into the brain, and cause a huge amount of damage. The general attitude is that like if you use antibiotics for these like basically viral infections, but there might be a small chance that they are a bacterial infection. Um, that it's no big deal or it's no harm using them, even if it's not. Um, the reality is that there are long term consequences potentially from using antibiotics. Also, I think there is just a lack of education. Like a lot of parents do think that antibiotics, like there was some big study there done that where like 55% of people, I think it was in the UK, thought that like antibiotics could be used to treat viral infections. Like when they can't. Um, but also just from the doctor's point of view, like they don't want to get sued by parents or by family of the patient if it's probably a viral infection, but then it turns out it was actually a bacterial infection. The doctors mightn't know. A lot of the time they don't. Like it could be anything that's causing an upper respiratory condition, let's say. And let's say it turns out it is a bacterial infection and they don't give them antibiotics. And then it turns out to be really bad. And then the doctor, suffers because the family sue them or whatever. So the doctor, just to keep himself safe, just prescribed the antibiotics. Okay. Um, so now on to the most important part of the video where I talk about um, the link between using antibiotics and weight gain. So the thing is, at least some people have been aware of antibiotics and weight gain since like the 1950s, and a lot of people seem to have just forgotten about it. But antibiotics are used and have been used since the 1950s by farmers to achieve what's called growth promotion. So growth promotion is basically just trying to make the animal bigger that's fed antibiotics, and trying to make the animal grow quicker, trying to make the animal fatter, trying to make the animal like taller, just bigger, like just bigger in size. Bigger size of the animal, the more money that you'll get as a farmer. So the way growth promotion works is that a sub therapeutic dose of antibiotics is given to the animal. And what farmers noticed was that when like a small amount of antibiotics was given to a young animal, like a young calf, let's say, um, the calves that were given the antibiotics grew bigger and heavier than the calves that weren't given antibiotics. And the farmers subsequently got more money for the animals that were bigger and heavier at the same age than the animals that were, not fed the growth promotion. Um, they weren't fed the antibiotic, weren't used for growth promotion. So then this kind of became like widespread, but there have been lots of experiments done on lots of different animals, um, like pigs, sheep, cattle, rats, mice, chickens, and they've all had the exact same sort of effect, like just bigger, fatter animals. And then there's also been experiments using like lots of different types of antibiotics. So using like penicillins, like macrolides, lots of different types of antibiotics, and they all had like, you know, more or less a similar effect. They all had like a kind of growth promotion effect. I think some of the antibiotics, different types, might have had a bigger growth promotion effect than others. Um, but they all had a growth promotion effect. So you could imagine what the consequences of this might be. If lots and lots of children were to get antibiotics, um, were to consume a lot of antibiotics, like what the negative consequences might potentially be. Um, so now the exact mechanism for how this happens, like why it leads to a bigger animal or why it leads to like more fat, is unknown. Um, but I will talk about what antibiotics do to the gut bacteria that's in your gut. Is that they basically just kind of destroy a lot of the gut bacteria. They don't just target, let's say, the negative, harmful bacteria exclusively. Most antibiotics will kind of kill bacteria like indiscriminately, the so-called gut bacteria, and the so-called, and then the bacteria that's causing the bacterial infection. So about 70% of all the bacteria on your body and inside your body is contained in the gastrointestinal tract. So the esophagus, the stomach, the small intestine, and particularly the colon, and then the rectum as well. And then the remaining 30% of all that bacteria is mainly just on your skin, on your eyes, and in everywhere else in the body except your gastrointestinal tract. Um, so the bit that is in your gut is called the gut microbiome, and the gut microbiome is essential. It's like it's not an organ, but it could be considered an organ because it's so important. Like if you didn't have a microbiome, like you would just die. Like it'd be like not having a heart or not having kidneys or lungs. Um, so what the gut microbiome is involved in, it's involved in digesting food, it's involved in supporting the immune system, it's involved in fat storage, it's involved in like synthesizing vitamins as well. Um, so and like the gut microbiome is somewhat like an understudied area. So like the all of the functions of the gut microbiome um we're not like completely aware of. Um there I mean one thing you hear a lot about is like the gut brain connection. So it does seem like a lot of the what goes on in the gut microbiome is connected to your brain, and often people that, let's say, have irritable bowel syndrome also can have, like anxiety or depression or whatever. Like a lot of serotonin is produced in the gut. Like that's a hormone that can like improve someone's mood and stuff. Um, so like bit of fairly understudied, an incredibly important part um of your body, and very important for your health. So how does the microbiome develop? So the microbiome develops right at the very, very start of your life. When a child is born through the birth canal, goes through the birth canal, spends a few hours in the birth canal, and in the birth canal, that baby, which has very little bacteria on it, is rapidly colonized by all the bacteria in the birth canal. And the bacteria in the birth canal is like very specific bacteria. It contains like pretty much all of the bacteria that that child needs in its life. That its microbiome needs to function and to help that child develop. So that child is completely covered in bacteria, and that when going through the birth canal and it's rapidly colonized, goes into its mouth, covers every square inch of its body. Then when the baby is pushed out into the outside world, it's exposed to like some fecal matter from its mother. Bit gross, but like that fecal matter contains bacteria and that also colonizes the baby, also helps develop that child's microbiome. Then the child is placed on the mother's skin, and there's bacteria in the mother's skin, which then colonizes the baby, also helping the baby's microbiome. Then the child suckles from the mother, you know, breast milk from the mother, and the first breast milk that comes out is actually called colostrum, and colostrum is very, very has contains like very, very diverse bacteria, like lots and lots and lots of different types of bacteria, and it's very important for the child to get that colostrum um, into its system. That bacteria in turn colonizes the baby as well. Then, as the weeks go on, colostrum does change just into regular sort of breast milk, and that breast milk contains just different types of bacteria, lower diversity of bacteria, but nonetheless very important bacteria. So there is a link between not being breastfed and the child being obese later on. There's also a link between a child being born via cesarean section and being obese, and that's because the child isn't exposed to the bacteria in the gut in the birth canal, and that the child isn't exposed to the beneficial bacteria in the mother's milk. Um, but anyway, once the child gets to about 3 years of age, um, the microbiome has more or less finished developing, and a 3-year-old's microbiome is roughly the same as an adult's microbiome. But in those 3 years, that microbiome has helped the child's immune system to develop, the child's digestion to develop, even it's involved in brain development. So you can imagine what the potential consequences of using antibiotics on a child who's under the age of 3, what they might be, that the microbiome mightn't develop in the correct way, and thus fat storage mightn't develop in the correct way. Uh, Bone growth might be too much. The brain development might be off a little bit. The immune system mightn't be developed properly. So, like allergies or autoimmune conditions, like maybe they might become more common in a child with an altered microbiome. Um, so just linking this back to obesity, is that one thing that has been found with obesity uh, is that, and it's been found again and again and again with obese adults, is that they tend to have a much lower diversity of gut bacteria than a lean subject. And this has been found a lot of times. There's been lots of different studies found the gut bacteria, the diversity of gut bacteria is lower in obese people. So the question has to be asked, like, why? Like, why is gut bacteria so much lower in obese people? Now, I would argue it's probably possibly something to do with antibiotics during under the age of 3, cesarean section maybe, not being breastfed, um, possibly all big contributing factors. um, to it. Also, if the mother is obese and let's say the child does go through the birth canal, the diversity of gut bacteria actually in the birth canal is lower in obese mothers, compared to like normal BMI mothers. So that could be a factor as well. But I know people might say, "Oh, it's like the food that obese people are eating, which causes the um the kind of low diversity of gut bacteria." But there's no real comparison. Now the truth is that the food that you eat will affect the composition of your gut, the bacteria in your gut. Like so, if you don't eat enough fiber, that can alter the gut bacteria. Eating excessive amounts of carbs, that can alter the gut bacteria. But there's no comparison between what like broad spectrum antibiotics can do to the diversity of bacteria in your gut, versus an altered sort of a diet. Both will lead to changes, but one a much bigger change than the other. Um, so yeah, that's it. That's all I have for today. But yeah, I hope you've learned something. Um, let me know what you think, and I'll see you in the next one.